what does the evidence say about the risk versus benefit for men to have a PSA test?
So I'll answer that very quickly. A PSA test is just a very simple blood test that measures an antigen in your blood. It's offered to men who are 45 or 50 years old. Your doctor will say, you're at that age where you might have a higher risk of prostate cancer, and I'm going to give you this test. The test, however, what you probably won't learn is that that could be the beginning of a medical nightmare for you. The PSA test is used, as one author described it, as lure to draw men into this bait to get their prostate removed. The stark reality of prostate cancer is that most men will die with it, but not because of it. Which is to say, this latent cancer can live in your body for many years. You'll die of something else. I'm 54 years old. There's a good chance that I have a 50% chance if they inspected my PSA levels that I would have some level of prostate cancer. Would I do anything? I wouldn't, because I think the main problem of testing men for prostate cancer with this test is that the test is not very specific and it's not very accurate. And so you get a huge number of men who are treated for prostate cancer for something that is likely to never go on to hurt them. And those men will get surgery, they'll get chemotherapy, and some of them will go on to become incontinent and impotent. A PSA test is a very bad idea. And this is not just Alan Cassels giving you my opinion. This is the opinion of the United States Preventative Services Task Force, who has essentially given the big thumbs down to PSA testing. And any man who's offered one, you need to stop and take a very close look at the information and the evidence around the harm related to PSA testing.
If I can speak, I had a friend call me up a few months ago. PSAs are normally down around 1, I mean, pretty low, 1, 2. He called me up and said, my PSA is 15. What do I do? The doctor wants to do a biopsy. I said, well, okay. Did he examine your prostate? Yeah, he examined my prostate. Before he did the blood test? Yes. I went, then it's meaningless. What do you mean it's meaningless? I said, it's meaningless. When he squeezed your prostate and examined your prostate, he put PSA into your bloodstream. I said, it has no meaning because it's irrelevant because of the doctor's exam before the blood test. So I had him go back. He had a PSA, I think 1.2, 1.3 or something, without the finger wave test. And so it all has to be very carefully, properly done.
Yeah, and if you, the night before, if you bounced on your trampoline or
have
rode your bicycle or had sex, there's a good chance you're going to have a PSA test. Now, are men told that when they're, the results come back and it's high? I don't think so.